Hello there. Today I will be talking about hemophilia. To give a thorough rundown of what hemophilia really is, hemophilia is when your clotting factors are very minimal, meaning that if you get a cut or something, usually someone without hemophilia, if they got a cut, it would stop bleeding after a while. But someone with hemophilia, instead of just stop bleeding, it wouldn't stop bleeding. It would keep going and going for a while because you were born with a limited amount of clotting factors. For example, if I take this knife right here, hemophilia A, also known as classical hemophilia or factor VIII, comes from the Greek words hemo, which means blood, and philia, which means affection. And yes, I know, that means blood affection. The first recordings of hemophilia was in the 2nd century by Jewish recordings. The disorder was later named by a student in Zurich University known as Friedrich Koch and his professor, Dr. Schonlein. Hemophilia is a recessive X-linked disorder. This means that hemophilia is carried on the X sex chromosome and is recessive. The chance of a child having hemophilia can be described on a Punnett square, as I am going to bring up right now. As you can see on the Punnett square on the screen, you can see that the father does not have hemophilia, but the mother is a carrier of it. When passing down the genes, there's only a 50% chance that if they were going to have a daughter, one of them would be a carrier of hemophilia. But if they are going to have a son, there's a 50% chance that it would have hemophilia, even though both of them have a hemophilia allele in their genotype. That is because in the male's sex genotype, since the Y chromosome can't block the allele on the X chromosome, the male only needs one hemophilia allele. But the females need two to obtain hemophilia, as their genetic genotype is XX, meaning that both parents need to have hemophilia for their female child to have it as well. As you can see in this image right here, if you have hemophilia, you will have buttock bleeds, forearm bleeds, neck swelling, soft tissue bleeds and bruising, thigh or calf bleeds, and iliopsoas bleeds as well. Some symptoms of hemophilia include excessive bleeding, large or deep bruises, unusual bleeding after vaccination, pain/swelling or tightness in joints, urinating blood, nosebleeds with an unknown cause, or, in infants, an unexplained irritability. If a child is showing some of the symptoms for hemophilia, as I stated before, then they may be tested for hemophilia itself. Tests for hemophilia include CBC, or complete blood count, APTT, activated partial thromboplastin time, PT, prothrombin time, and, of course, the Fibrogen test. The average age of male with hemophilia, if they have proper treatment, is 10 years below the average male's age. But before we had any treatments for hemophilia, instead, the average age for boys would only be 13 years. Hemophilia doesn't only affect someone who has it with blood clotting issues, but no, it affects them in other ways as well. Because of the limitations people with hemophilia have, it is difficult for them to do such as getting an education that would suit them or getting a job because, as I stated before, they are very limited to the things that they can do. Hemophilia doesn't only affect the person who has it, but also the people close to them or the people around them. Their family would be bombarded with all the medical bills and costs of the treatments for hemophilia, such as replacement therapy, which is shown to be very expensive. If you think that's a lot, then think about this as well. Your insurance will go skyrocketing because someone in your family has hemophilia, meaning that you'll need to pay even more, and it could lead into serious debt and other things of the sort. Treatments for hemophilia include, In the day we are in now, we are lucky that hemophilia is very treatable. Treatments such as replacement therapy and prophylactic are showing to be very productive and very successful in treating the disorder. If you don't know what replacement therapy is already, let me tell you. Basically, what replacement therapy is with people with hemophilia, because they have very limited clotting factors and their blood doesn't clot and all of that. Because of that, replacement therapy is when you inject clotting factors into your body so you will stop bleeding as much. You will still have minimal bleeding, but it won't be as much as it was before. At the time we are in now, gene therapy is proven to be a very successful treatment for hemophilia, making people who had hemophilia before nearly have almost normal bleeding rates. This leads into my next point, which is before in our modern world we are in now, before then, people didn't have a cure for hemophilia. They didn't have it. As I stated before in my age sentence, kids would die at a mere age of 13 without treatment, and that's because they used treatments such as snake venom, bone marrow, lime, and many other ridiculous things. Some other thought of treatments of hemophilia before we even had a cure for it was oxygen, the thyroid gland, hydrogen peroxide, gelatin, and plasma transfusions. Even more. In this video, you learned about hemophilia, what it was, some symptoms of it, treatments of it, and more. I hope you learned a lot today, and goodbye.